So I'm here with Carina Ferreira-Borges. She works at the WHO. I'm gonna let her introduce herself and tell us which roles is she now implementing in the WHO and what projects is she coordinating and working on. So if you could tell us something, Carina,
Thank you.
about
yes,
that.
of course. So I am the regional advisor for alcohol, illicit drugs and prison health in WHO Regional Office for Europe. And this means basically that I coordinate with 53 member states the support on alcohol policy or on drug policy or in everything which is related also to health systems in the prison context. I know what brings us here more about alcohol, and in that sense I coordinate a big EU project supported by the European Commission called EHFG. Basically this is about bringing evidence into action. So how is it that we bridge that gap on having evidence that comes from the research that, you know, among scientists is well known, but not necessarily applied for policy action.
Okay, great. If you could tell us more about particularly the WHO Europe, and what is WHO Europe doing in shaping member states' national alcohol policy? So in a more macro view, besides your roles, what is the WHO Europe doing in member states' national policy?
So what we do is to support in terms of what is the evidence available and how this can be applied at a national context. So for example, we have countries that request us to do an analysis of their policy implementation and the impact in, you know, mortality, you know, on those, you know, health indicators. So we do that. We also look at laws that are part of, you know, the national policy. Some of the laws that need to be updated so that they are aligned with the global guidance. And we support also member states to, for example, do some kind of specific analysis on where they are in terms of trends regarding alcohol consumption, and then, for example, you know, policy dialogues so that we can bring that data to the national context, have discussions with different areas that are not just about health areas, but, you know, bring different stakeholders, economy, finance, education, you know, social services, you know, all together to discuss how all intersects with, you know, the different policies. So it's about putting alcohol in all policies, given that it impacts in all policies.
And it's very relevant, of course.
Yes.
Also, one project that you've been working on as well, and it's very recent, which is a new report by the WHO Europe, and specifically that you've been also working on, which is the commercial determinants of non-communicable disease in the WHO European region. And since it's very recent and it's also very relevant, could you guide us to the main takeaways of that report and what you think that we should keep in mind by reading this report, of course?
It's a very important report, and I'm actually very happy that in Gastein we have been here along, you know, the several days of the discussions, the mention to commercial determinants. So this report is about what impact commercial determinants have in non-communicable diseases. Basically, the main message is that we have a huge burden in terms of mortality in the region, which is linked to non-communicable diseases. 9 out of every 10th death is linked to non-communicable diseases, and that 2/3 of those deaths are due to risk factors. So this means that risk factors like alcohol, tobacco consumption, unhealthy diets, and lack of physical activity are the main drivers of a lot of that mortality. So importance of the prevention and importance of the region. One of the messages is that there is a commitment from the member states to achieve targets that have been set to reduce those risk factors. And what we see in terms of the evidence is that we're not really
not doing enough.
Enough to reach those targets. So actually we will fail to reach those targets. So this is another message that we bring, that it's not enough what is being done. And one of the main reasons that those targets are not being met is linked to the role of harmful industries and the way that this corporate activity interferes in implementing evidence-based policies, because the policies are there, but they're not, and the evidence is there, but they're not implemented. So the report really calls for more action and drives the importance of addressing commercial determinants as a means to really unblock the progress and support the countries in achieving those targets.
Following up on that, could you tell us more of how does the alcohol industry uses their lobbying and their strategies to try to influence public health policy, in the sense not just in the European level but also just in each member state? So what tactics are used and how can we minimize their interference in evidence-based policy? So what can we do as member states to try to minimize
So the
that?
activity of the big corporations, we call it big industries, the harmful industries, because they produce harmful products. So this is what we're talking about when we talk about commercial determinants of health and the big industries. It's that they engage in political activities that basically are aimed at preventing or weakening or undermining the policies that will have an impact in terms of public health gains. And this hinders the progress and can be very diverse. I mean, it can be done through direct lobbying at the European Commission, and we have a lot of examples. They have been shared here by many stakeholders on the unequal treatment, for example, that, you know, these big industries are having meetings with the European Commission, you know, like 22 meetings during 2022, while civil society only had, you know, 2 meetings, for example.
Wow.
So very concrete examples, and many times they go to meetings all together. So while industry groups go one by one, civil society does not have that opportunity. They can be received, so very little and all at the same time. So this is one. You know, many times also at the national level, we've seen there was a study done by the European Consumers Association that looked at some papers, some documents, also on the influence of, again, you know, lobbying very close to national authorities, and then, you know, using those national authorities to lobby in the Parliament when the Nutri-Score labeling, you know, was being discussed. That basically led to undermining the potential of, again, you know, an important public health policy. So these are ways. There's many other, like, for example, using, you know, threats to governments that decide to go ahead, or universities, for example, that want to study more. If we consider alcohol labeling, there's a study that was done in Canada. It's called the Yukon study, and what happened is that the study stopped because of a fear of lawsuits threatened by the industry, because they didn't want, you know, the researchers, the university, to test, you know, the power of, you know, labeling in alcoholic beverages. So the university was scared to continue because they would not have money to go to court and face a legal, you know, you know, all that comes with that. So, so different strategies, you know, raising fear, you know, also another strategy can be through other groups, you know, using groups like, you know,
think tanks sometimes.
Think tanks,
as well.
yes, So many different strategies. It's diversified with the power that they have, which goes to the amount of money that is invested in all these type of activities, so that they can continue, you know, with their business and not be threatened in terms of the profits.
Thank you so much for sharing your thoughts. I think just to finalize, would you give any example of a member state that is implementing policy at the level of reducing harmful effects of alcohol that you think is a good example that other member states, other countries might implement and follow on that example? Sure.
So one very good example is we did a study on it's called, it's the Baltic States project. So basically, Baltic countries, you're talking about, Lithuania, Latvia, and Estonia. So, we have 3 countries which are small countries with borders. And what happened was that there was in Lithuania an increase of taxation, reduction of availability, and ban on alcohol marketing. So we studied the impact not only in Lithuania but across the borders of applying this policy. What we saw was that for Lithuania concretely, and you asked me an example of a country, we've seen that when you put in place these policies, you have immediate results. And there was an immediate reduction when they introduced taxation in terms of the mortality and reduction in terms not only of the mortality, but there was also, for example, an increase in life expectancy. Years of life gained because alcohol consumption was reduced. So actually alcohol is one of those substances where when you implement evidence-based policies, you can see immediately the results in the population, that it works and that it has an impact.
Okay. Thank you so much for your time, and I think for now our interview is over. So thank you, Carina, for being with us.
Thank you. A pleasure.
Thank you for the Young Forum Gastein for this opportunity to interview Carina as well.